Hi, I'm Mandy, and I always start by yelling, which is really dumb. Anyway, this is Stories from the Valley, and I am Trapper from Chiroway here, and he is going to introduce himself and his business and what he's coming to tell us about here at the Croix studio.
Absolutely. Thanks for having me.
You're welcome.
My name's Dr. Trapper. I own Chiroway of Hudson, and I'm originally from Rice Lake, so a little bit north of here. Got a family, got a wife, got a 2-year-old kiddo, and just excited to bring some education to the area.
And 2-year-old means you're tired?
Chaos some days. Chaos, yes.
How was it going into fatherhood? Was it everything you thought, or was it a huge...
I mean, it's a big change. Yeah. So my wife and I have been together for 13 years now, and married for going on 2 years.
Okay.
So a little bit unconventional. I was going through school, and so in undergrad I played football, and that process brought me into looking into professionally playing football. So I spent a year training, trying out for the NFL and the CFL.
Oh my gosh.
And so life was crazy then too. And so then after a year doing that, I decided to hang up the cleats. And
so you didn't get drafted?
I didn't get drafted, but I had an agent and had a pro day for the NFL. And then calls kind of went cold there. So then I went and tried out in the Canadian Football League and was brought into mini camp for the Calgary Stampeders. Amazing experience. Crazy the level of athletes that were there, and was one of the final cuts there. So after that, I was hiding a shoulder injury, and I said, it's time to just hang up the cleats and move on with life and have a family and a career. So that's what led me to here.
Okay, that's a big change.
Big change.
But I'm supposing with football, it kind of goes with what you had some
sure, yeah. So in high school, my parents would have me go to a chiropractor sometimes. Okay. And so I had previous experience with it, and I knew I wanted to go into the medical field, but I was looking between dentistry and physical therapy and chiropractic care. Kind of a wide range.
Yeah.
And I got sitting down with my now mentor, and after having a conversation with him, I knew I wanted to do something that I could positively affect people's lives while they're with me.
Okay.
What I find is I didn't want to just sit down and give exercises and hope that you go home and do them and have it be a vicious cycle where I can positively affect the neurological system while you're in my office.
Okay.
And then you get to go live your daily life being more adaptable and better functioning.
Okay. We got in a motorcycle accident before we had kids, so this was a long time ago.
Okay.
And we had chiropractic care. It was our first experience with it. I grew up with, the negative side, maybe being more influenced by that you don't need a chiropractor,
For sure.
We did find that it helped our healing a lot faster.
For sure. Yeah, it definitely can. There's definitely that aspect of those acute injuries, whether it's MVA, workman comp, those kind of injuries. Okay. I don't necessarily focus on those.
Okay.
There's a million different chiropractors that focus on different things. So I'm much more on the wellness side of chiropractic care, where I want you to come in and be able to better function and adapt. And we do that. Your body functions via the neurological system. And so if we can make sure that neurological system is clear from the brain to the body and then all the way back, you're better able to function. That's going to most likely reduce your chance of injury. It's going to let you just function better, be clear-headed. People walk into my office with no pain, and they come back week after week on their choice because they see those added benefits that they weren't thinking of when they first walked into the office.
Okay. So how did you come into Chiroway?
Yeah, so that would be my mentor.
Okay.
I played at University of Minnesota Duluth, and he also played at University of Minnesota Duluth 15 years prior to me, more like 18. And he came and spoke to the team when I was a junior. And that's where I made the initial connection. So the Chiroway was founded in Woodbury in 2010.
Okay.
And he, in fact, the next franchisee to sign on with Chiroway also played football.
Oh.
So there's a few of us.
Okay.
And
seems like a theme.
It is. And he decided that the best way to do it is as a team and to have us all be part of that instead of just having one owner. And so he started the franchise. And so when I sat down to meet with him after when I was done with football, saying, what am I going to do? Like, is this the right thing to do? Sat down and I really started to train with him and follow his lead and see what it was all about, because I could have went down the more physical therapy of chiropractic care pathway. But again, that's not what I wanted to do. And after seeing how he practiced, it was exactly what I wanted to do. So throughout chiro school, I was in his office training under him for, it was 4 years of training under him before I officially opened.
Okay.
So
it's almost more like an apprenticeship.
It 100% was with him.
And do you still work with him?
Yeah, so I talk with him probably daily, just about the franchise and where we want to go with everything that we're doing.
Oh, that's exciting.
Training on our technique, because our technique is unique compared to everyone else. So we use a neurologically focused tonal technique.
Okay. It's called You're going to have to explain it.
Yeah. So it's called advanced muscle palpation technique. So in essence, and in the simplest form, when our body goes out of place, so the spinal vertebrae go out of place, the only way that those are able to move is via muscle.
Okay.
So what we do in comparison to what other chiropractors do is go in and use the muscle tone. So think a flex bicep versus a relaxed bicep and how much different those muscles feel. We're going into the spinal muscles and feeling the differences in that muscle tone. And if you know what muscle it is and you know where it originates and where it attaches on each side, you know what the action of that muscle is trying to do with that bone, trying to pull it back. And then we use that muscle to facilitate the adjustment.
Okay, so you're correcting it?
Correcting the bones so that what the term in chiropractic is called, it's called a vertebral subluxation. Big word. In essence, means your vertebrae is out of place.
Okay.
And in between each vertebrae, you have your central nervous system going through, and then the nerve roots go out between each vertebrae.
Okay.
And when those bones go out of place, it puts interference on that nerve.
Okay.
The way the body moves those bones back is via a reflex, because that nerve can sense that input on that neurological system, and it tells that muscle on either side, depending on where that bone is located, of saying, hey, that reflex, you need that muscle to become active to pull it back into place.
Interesting.
Because your body is super intelligent and it knows it wants to be in alignment. And 99 times out of 100, it does that.
I had a family member who was struggling with neck pain after having, I think, her 4th or 5th child. She's had 7 now. But she had neck pain, headaches continuously, constantly going to the doctor. I think it was a year of pain, and it wasn't until she went to a chiropractor and started working with them that she's no longer in pain. But it took about 2 months to correct it.
And a lot of that's just about the stress that we put into our body.
Okay.
So especially when we talk pregnancy is a lot of stress on the woman's body.
I'm glad the opposite.
Correct. My wife, I made jokes with her that I said I'm glad the male in the situation, because she struggled through pregnancy, and I was glad that I was able to help.
Okay.
But that's not a fun thing to go through sometimes.
No, I didn't enjoy either. I mean, I liked the fact that I was going to be giving birth, but I was scared. I was nervous. I was also working as a para at the time. So I did go see a chiropractor during pregnancy, like around the 8th month, because I started to get ligament pain.
Yep.
And when I walked, it was very painful.
Yep.
And it was actually my doctor who suggested that I go see a chiropractor to help with some of that pain during pregnancy so I could make it through the next month and a half.
Yep.
So that would be a great transition to talk about that, because that's what you're going to talk about here on our education.
Sure.
Right? So
so getting into pregnancy and chiropractic care, a lot of people ask me, when should I see a chiropractor? Like, at what point in pregnancy? And my best answer for that is before.
Okay.
And that's kind of what we're going to get into during that conversation, is kind of break it into 3 phases. It's the getting pregnant, the pregnancy, and then the postnatal care. Each have different attributes that you might see a few different things. But the way I kind of attune it when I talk about the pre-pregnancy or trying to get pregnant, if you're going to take a long road trip somewhere, are you going to make sure that the car oil is changed? Are you going to make sure that the tires are...
My husband would do that, but yes.
Correct. So it's the same thing with the body. Let's make sure that your body is functioning in its best form of function before we're getting pregnant.
Oh, that makes sense.
It can possibly help with pregnancy. It can the getting pregnant, it's just going to make things smoother, and then it allows us to keep you in a good place through pregnancy rather than doing the catch up.
Okay, that makes sense.
So we're going to touch on that, and then it's once you're pregnant, obviously there's 3 trimesters, and the first trimester is a hard one for people because of that morning sickness. There's a lot of changes happening in the body. Hormones are running wild. And if we can just ease the neurological system so that there's a little bit more calm and peace and ease, that's really big. And then towards the end of the first trimester is when the woman's body starts to produce a hormone called relaxin. And it really vamps up come the 8th and 9th month. And essentially what the relaxin hormone does is it allows ligaments to stretch so that when baby is time to come out, it allows the pelvis bowl to function, to move, along with the sacrum to rock back and forth. And so that's where women start to feel that really uncomfortable, not alone just having the big belly, but it's just that pelvic pain, because things get out of whack.
Yeah, I had some sharp, I thought I tore something, and my doctor said it's all just part of ligament, and it's crazy what that does. Now, during the first trimester, going back to that, does the chiropractic care ease any nausea symptoms or any of those symptoms? Can it help with that?
I'm never going to promise someone in my office that if you come and see me, that this is going to be fixed. Because at the end of the day, it's your body healing itself. And all I'm doing in my office is making sure that neurological system's clear so that it's able to do what it naturally wants to do. And so I can't say that it's going to help with nausea. The nausea is a hard one for a lot of people, for sure.
My second pregnancy was no fun.
No.
But I truly believe that's because my daughter Dorothy just wouldn't stop moving. Even at that first age.
So a lot of kicked in the ribs and the liver kind of deal.
Oh, yeah. She didn't move at all at night. So how often do you usually have, I'm guessing it's on a case-by-case basis.
It is. I think it is case by case, but my main recommendation for someone who's pregnant is to come in and see me weekly. Just because life throws a lot of different stressors at us, and then pregnancy on top of it, you're trying to grow a baby. Let's just make sure that you have a good foundation and that you're clear and you're functioning. And so that is my main recommendation. And so something that I'd like to touch on is I talked about our main technique in chiropractic care, which is that advanced muscle palpation technique. There is a group called ICPA, which essentially is a group that does research and gets together, and it's a group of docs that researches kiddos and pregnancy is their big focus. And so they have a technique called the Webster technique. And you have to go and get certified in this Webster technique that's specifically developed for pregnancy. So I went down 2 years ago to Iowa and did the training. So I'm certified in Webster technique. And with Webster technique, the main goal is to reduce tension on the muscle and on the ligaments, specifically in the lower half of the body, so your pelvis. And the focus is just reducing that tension, optimizing the movement of the pelvis. With that, when we optimize the pelvis and the ligaments, that's also introducing the round ligament that attaches to the uterus. So the goal with Webster is just to make sure everything is moving well, but then also with the uterus, making sure that there isn't any additional tension on the uterus. So when you have all these ligaments, specifically the round ligament that attaches to the uterus, if your pelvis is out of whack, that puts tension on that round ligament, which attaches the uterus. And the best way they described it is think about crawling into a freshly made bed that the sheets are really tight. That's kind of happening to baby in the uterus when that happens. So we want to make sure that that's optimum, so there's more room for a baby to move and grow and develop the way it needs to.
This does actually help with the birth process as well.
Absolutely. There's a bunch of research, and I don't have the statistics off my head, but the Webster technique has been associated with better birth outcomes and easier births.
And have you had a lot of different people who come in that prefer natural versus, epidural and see a difference?
Yeah. So in that case, my adjustments and stuff don't change. I like to make sure that every person has the resources that they need to make the best decision for themselves. I'm never going to tell someone that they need to go have a natural birth or do the epidural. Like, at the end of the day, that's mom and dad's choice. And the outcomes, it's all just so dependent per person. But it's gonna help no matter how you're gonna give birth.
Yeah, that round, now that you said round ligament, that was what I remember the pain being, and that was not a fun pain.
No, I can only imagine. I can't say that I know it.
I was working at the time, and as a para in the school district here in New Richmond, and so walking with each step, it just felt like I was breaking something, and so I probably should have gone and seen a chiropractor more often, I'm guessing.
Probably.
That's the case.
Probably. Yeah, it's one of those situations, if you have the time, the energy, and the money to do it, I suppose.
Yes. Okay, so now let's talk. I didn't know about this till after I had a baby, but 4th trimester and babies. So how do you move into that care?
Yeah, so it does get into a little bit of how you gave birth. When someone has that epidural, it is a needle that goes into the spinal cord. And so for the first month or so, I don't specifically adjust the low back because that is an open, technically, wound, even if it's a needle. And we avoid that area, but I'll continue to use Webster for the first 1 to 2 months post baby coming. And that way we can just continue to optimize, going back to that hormone relaxin. That it amps up 8th month, 9 month, and then it'll slowly decrease. But research has shown that it's in a female's body 6 months, 12 months, sometimes 18 months after baby. So women continue to feel like they're out of place. Something is not right. That much longer.
And then if you have babies back to back.
Correct. And just keep that going.
I'm 5 years out, and I only feel like I've just started to become myself.
Some women hold it a lot longer.
Yeah.
So, but what I will say is, as soon as mom and baby feel like they can get into my office,
Okay.
I will take time. My wife is absolutely amazing that she knows this is my big passion and she knows how much it helped her. That in that 7-month-ish, I give all my clients that are pregnant my personal phone number.
Okay.
And I'm basically on speed dial for them of, okay, baby, I'm about to be going into the hospital. I want to get adjusted one more time. Or that was a rough birth, or I just had a great birth, but I want to get adjusted. And so sometimes I have met moms on the way home from the hospital
Okay.
in my office to get them checked.
Okay. So have you gone into the hospital at all?
I have not.
Are you able
I have
to, I guess?
not. Most hospitals won't let us go
all right.
in. I did go. I had a mom that had to have a cesarean.
Okay.
And so she wasn't able, she lived her staircase. They got her upstairs
Oh.
and they're like, she can't come down. So I actually went into her house and got her
Okay.
adjusted. So I'm willing to do that too. You'd have to be under care with me prior to that.
Okay.
But if you're under care and I need to come in and see you, I'm definitely more than willing to do that.
Oh gosh, I can't imagine. It must have been nice for your wife then after you could do it in the hospital.
Yes.
In that case.
Yes.
And those beds at the hospital are not comfortable.
Great. No.
And so it would have been great. I got a massage on the first one, but just getting adjusted probably would have been
for
a huge
sure.
help.
For sure.
I did have epidurals with both.
Yep.
So I had fairly easy births, which is not everybody's story.
Not everybody's
Pushed for 20 minutes and that was it. So
good for you. Good for you.
Dorothy was on the way out when the doctor was like, "Oh, it's time." And so
yes.
I was very, very lucky in those two circumstances. But again, that's not, I mean, it almost seems like the majority of women's experience tends to be.
Yeah, and it really, sometimes it's that first one that's the worst.
Okay.
That's kind of what I've seen. But again, some people have 5 and they're all bad.
Yeah.
So it's just case by case.
Okay.
But again, anywhere I can help, I'm willing to help. And just whatever the mom needs, I try to help with.
So now moving on to baby,
Yes.
How does that work?
Yeah, so right now my record is 17 hours old. Mom met me on the way home from the hospital. And with babies, some people are like, how do you know like if a baby needs to get adjusted? It's my absolute favorite. They're so adaptable that when we go into the pelvis specifically and the occiput, and we find that spot where that restriction is happening, and we can get it to release, people are like, well, you're going to put a bunch of force into a baby. It's nothing like that. It's all the best way for pressure-wise that I can think of is if you put your finger on your side of your mouth and you push till you feel your teeth.
Okay.
That's how much pressure I'm using.
Okay.
And it's just light pressure into that muscle. And with babies, again, they're so adaptable that when you get that to release, a lot of times you can just see their whole body relax because they're very attuned to their body. That's all they know at this point. And so they just go to a full relax and like fall asleep sometimes.
Oh.
It is amazing.
I have heard that obviously I have 2 babies, but they haven't told me that birth is actually fairly traumatic for them.
Very traumatic.
And so I didn't know about taking a baby to a chiropractor till after I had my first.
Yep.
We thought she was colicky. She wasn't eating very well. She was born 5.5 pounds on time, healthy. When they suggested, I had a friend suggest chiropractor simply because they said that it would help with going to the bathroom. And so everything else was just a bonus.
Yeah.
So how often do you then see baby? We only went once, I think.
Yeah, I mean, again, case by case.
Okay.
Like you said, birth is one of the more traumatic things we all go through in life. Luckily, none of us remember it. You got to think about it. You're getting pushed through a small hole, squeezed, pulled, depending on how the birth is. They really get pulled. And, I mean, baby comes head out, hopefully.
Most of the time. Yeah.
And there's pull on that neck as the doctor's pulling out, and it's just how it is. But unfortunately, it's putting a lot of tension and stress through the upper cervical. Okay. And so I'm always going in and checking with newborns that upper cervical complex, because a lot of times there's that stress and strain on it. And then down in the pelvis, I call it the poop button.
Yeah.
So it's this,
you are not the first person I've heard that. And now that you say that, okay.
Yeah. So it's essentially what it is your sacrum or your tailbone. Okay. And with babies, they're moving. Well, if we're talking a newborn, they're not moving too much. But when they get a little bit older, they're really moving, and really things just start to move and things get a little stuck. And that added pressure on the sacrum sometimes can make kids a little bit more constipated, whatever it may be. And when we get that adjusted, sometimes mom isn't even out of my office and she's going in the back of my office to change baby's poopy diaper. So
much fun.
Yes. So
is that an industry term then, poop button?
It might be.
Because I've heard that.
It
before,
might be. I probably heard it from somewhere and started using it.
Okay.
But I don't remember the exact reason.
I don't know if we went in with our second or not. I can't remember. That was because it was during COVID.
Yep.
So things were just different for all of us.
For sure.
But my first, I remember definitely helping, but I was so out of my mind with my own stuff that I don't like. I remember feeling good though because she could sleep. It felt like she slept better and felt better.
For sure. And people, I mean, again, this goes back to even like the adults. I can never promise that you're going to notice that the baby's sleeping better or they poop better. What I usually tell my parents that have never had a kid under chiropractic care is after the adjustment, there's going to probably be something big, whether that's a big poop, a big cry, a big sleep. That's just that tension release that we got from the adjustment. And that's a normal and a amazing thing. Get a couple extra hours of sleep.
We all need that anyway, no matter what age we're at.
Exactly.
So, and then how long have you seen babies for?
I mean, a lot of my clients become lifetime clients, if I'm going to be honest. So going back to like how often I see babies, again, client by client dependent. That first month, I think, is really important, again, to see weekly. Okay. And then some parents decide to drop down to, let's just get the baby checked once a month.
Okay.
And then what's nice about how we practice is they're down to once a month, but all of a sudden baby is a little bit more fussy. There's something going on with baby. They can tell. They can come in additionally with no issue.
Okay.
So
yeah, it seems like those milestones always, I mean, their bones are growing, everything's growing at such a rapid rate. I can't imagine if your muscles are out of joint and
just the stress of growth when you're that little is crazy.
Well, and then when you start crawling and trying to walk and
falling and jumping off of things, I'm in the middle of that
We're still jumping off of things with my 5-year-old.
Yep.
We're constantly on guard.
It's many car accidents for them every day.
Yes, it is very intense. Have you noticed with babies and coming in like a difference between formula fed and breastfed and chiropractic care? Because there seems to be so much discussion.
There is, and you're going to talk to, you're going to get a different opinion on this from every chiropractor. I was in a unique situation where my daughter had some allergies and she had really bad acid reflux. Okay. So we had to do formula. And for me, I'm never going to tell a mom that you need to breastfeed or
fed
whatever.
Is best as always.
Correct.
Yeah.
I just want to make sure that the baby's healthy. And if that means that they have to have formula, that's what they have. And they're going to have happy babies.
Okay, and you don't see any difference as far as an increase in chiropractic need or anything?
No.
Okay. Because formula fed, we had a lot of gas.
Sure, there might be more of that, and you're going to see different rates of bowel movements in between a formula fed versus a breastfed. But if you know that that's coming, that makes it normal.
Okay. And I'm guessing the chiropractic care helps with the gas
It
movement.
definitely can,
Okay.
right? It's just the same thing with that bowel movement. It's the
Okay.
same process. As long as everything is getting the neurological input that is normal to that baby, things are going to function and move the way it should.
Okay. Now, I think I asked you this when we first met because this is always one of my questions. What is that machine that people use, and do you use it versus are you manual? Is that correct?
It's a manual adjustment. So it's called an activator.
Activator.
Some people call it the clicker.
Yeah, I watch it on TikTok.
TikTok and YouTube. Yeah. So I do have a activator. Okay. I use it in special circumstances. I'm more hands-on. What I like about being able to be hands-on is my hands never lie to me and they never fail, where a machine can fail. Okay. So if I can use my hands, I can feel the adjustment happening, where if I'm using a clicker, I have to click and then feel to see if there is that
if it
change.
Actually works.
Yeah. Okay. So in special circumstances, I will, but that mainly sits up on the shelf and doesn't get used all that much.
When we had our motorcycle accident, it felt like it was so fast. Like it was just click, 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 click. And I don't know if there was a difference or not.
Yeah.
I don't.
Yeah. I mean, there is research behind the activator. But again, it's just not my preference of use. There's like 120 different techniques in chiropractic care, and each one is different. And it's just about finding which one fits best for you.
Okay. In your office, would people, when they come to see you, are they seeing you or do you have associates?
Yeah. So getting into a little bit about the Chiroway way, our offices are meant to be affordable and convenient for people. So we are a cash-based office. We don't take insurance, but we want to stay affordable so that full families can see us. Okay. It's the family model of if people are having to worry about their pocketbook, they're not going to be able to get everyone in. So we don't want to charge an arm and a leg for our care. Okay. I'd rather see more people and affect more people than charge more and see less. Okay. And then the convenience aspect, we don't take appointments. It's all walk-in base. So once you're a client, you get my hours, you come in.
Okay, you were talking about the process of walk me through someone coming through the door. What are they going to see?
Yeah, so on the initial visit, I do take appointments for the initial visit.
For the consult?
For the consult. Right. So first, I will do a free consult with someone anytime they want to walk through my door. What I like about those is let's see what you have going on, because I might not be the best fit for everyone. Okay. And there's a lot of chiropractors out there, and I get connected with all the chiropractors so that if you're not the right fit for me, I want to get you to who's going to be the best fit. Okay. So let's do a 15-minute conversation about what you have going on. And if you aren't the right fit, I'll get you in contact with the person that you should be seeing. And then if you are the right fit for me, we'll sit down, continue to have that conversation. Let's really dig into what you have going on, why you walked through my doors, decided to make that appointment. And then we go through a full health exam consultation. And then at the end of that exam, as long as we don't find anything extremely bad that we need additional support on, we'll get you adjusted on that first visit.
And how long is that appointment?
The first visits, I tell people to give it an hour. Okay. Some are 45 minutes. Some are an hour and a half.
And are you doing x-rays or anything?
So I don't do x-rays in the office. It really just depends on what you have going on. If you have something on the more serious side where we need to get additional imaging, I refer you out to a partner in the community to do that. But a majority of the time, people don't need that additional imaging. Just really depends.
Okay. And then they get the treatment plan from you?
Yeah, so I don't even call it a treatment plan. I call it a care plan because, again, I'm on the wellness side of things. Okay. And so at the end of the visit, I get you adjusted, and then I'll give you my recommendation of care on how often I think you should be coming in to see me. And it's very dependent on your lifestyle, your goals, and how much tension you walked into my office with.
Okay.
And based off of that, we'll make that plan. So I essentially have 4 different plans that we can go on. The first one is weekly care. So 4 visits a month, bi-weekly care twice a month, monthly care, which is once per month, and then a pay-per-visit option where you just pay at each visit. And that way people can make their own health choices. What I tell people is I'm not a pressure salesman. And so let's get you adjusted. I'm going to give you my recommendation, but at the end of the day, I want you to make the choice that's right for you.
Okay.
Because if I force you into something that you don't want to do, you're not going to follow through with it, and you're not going to get the benefits of chiropractic care.
I hear that a lot.
Yes.
Yes. Okay. And then, so for the education night, what are you planning?
Yeah.
Who's coming with you? What are we planning
absolutely. So it'll be myself and then Caitlin Lambeck with Revive and Restore. She's a holistic nurse that does comprehensive testing, and then IV therapies. So she's going to be touching more on the internal side. Let's make sure your gut health is good. Let's make sure that your hormones are in a good level. And then she's going to just kind of go through that throughout all pregnancy, postpartum. And then also Maggie with Pine Valley Counseling will be coming with. It's a side of pregnancy and care in people's lives that people don't realize that they need.
Until it's too late, essentially.
Correct.
And now you're trying to do damage control. That was me.
Yeah, so sitting talking to Maggie, she wants to really touch on something that people don't think about that a lot of people are going through is infertility.
Okay.
And the mental struggles that come with infertility for mom, for dad, and how she helps with that.
Okay.
And then just kind of through pregnancy. And then the big one that people are more aware of that it doesn't get touched on as much is the postpartum depression and anxiety. And what people don't realize is that first 6 weeks is when people think that it's going to happen. But a lot of times it's that 6 to 9 month range that people are really affected by postpartum depression, because the help isn't there usually at that point. That first 6 weeks, a lot of times people have help from family, whatever it may be. Yeah. And you hit that mark and people are like, okay, you guys got this. You don't need any more help.
It's still amazing to me that they send a baby home with you with little to no education beforehand or after. And they're like, you got it.
Even with the education that I have, backstory to my pregnancy, we had a very tough pregnancy.
Okay.
My wife had gestational diabetes, and then she had preeclampsia.
Oh my gosh.
And so baby had to be delivered via C-section 4 weeks early.
Oh.
And that didn't go great as well. Okay. And then baby wasn't breathing coming out of mom's tummy, and so she was in the NICU for 3 days.
Okay.
We were there for a week. Luckily, Lila is completely healthy now. No, nothing.
Yeah, but that's a lot of stress and
very, very stressful and very difficult on mom. Okay. And so, as hard as it was, I use it as like a learning thing for me now that I have that experience. I know how to talk to parents a little bit better because I've been in that situation. Yeah. And so being able to have that conversation and making sure people have the help that they need and the education. Like we were just talking about, you get sent home with a kid and it's like, oof, what is this? Well, do I actually know what I'm doing?
It's one of my favorite things when parents come in for sessions, and both parents need to help change the baby because you're like, am I going to hurt them? And, I mean, at least you probably knew that their body's a little bit more flexible, but even just putting a shirt over baby, you're like, do you feel that tension versus a mom who comes in with their second and they're like, just you change them. It's fine. You got it.
For sure. And people have family that
Yeah.
usually help. That going back a little bit farther in our conversation of when I like to see mom and baby, part of the reason I like to see mom and baby right away is you kind of get rushed out of the hospital. And usually you have a lot of questions, where if you come in and see me, I'll sit and answer questions all day to the best of the knowledge that I was given through school and my personal experience, and just be able to help give you the answers that you might still have. And if there are questions that I'm not able to answer, I have really good resources in the community that I'll get you in touch with the people that you need, whether that's lactation consulting, because that is a big one.
Oh my gosh, that one was one I was not prepared for at all.
Yep.
That's someone I'm hoping to have that in here as well to discuss, because again, that's not something that we're prepared for.
Very, very good resource for that. A lot of times these hospitals don't have the funding to even have lactation anymore. So that's a big missing piece of the birth and becoming a parent of the lactation.
We got a DVD.
You don't age yourself like that.
No, this is 7 years ago. We had a DVD in the hospital, and they put it on. It was 20 minutes, and both my husband and I are out of our minds, exhausted. Yep. It was a full day of people visiting, and it's our first baby. And we were in our late 30s, but we felt immature because you're watching this video just out of your mind, tired. Women you don't know.
Correct. Correct.
So it was just not the best education. Plus, my husband comes from a farming background.
Yep.
His dad used to be a dairy farmer.
Okay.
So his experience was cows. And so
a little bit different.
A little bit, but I got compared a lot to a cow. And I love him very much. It just came out of him. And so a little bit different. I think it would be great for both parents to have that knowledge, especially like nutritionally what we need, how much time it's going to take. That first couple of months, your job is just to feed that human being.
Correct.
Even if you're formula feeding.
Correct.
And how much time that takes. And so often it's the guilt of feeling like we're not doing anything, but we are.
100%.
And so, there's so many things that go together, and you almost need like a care team after
for sure
you have a baby. So
for sure. And that's kind of my big goal. One of my big goals in the office is being able to be that resource that'll get you the resources that you need. Doesn't matter what it is.
Okay.
If you tell me you need something, I will talk to enough people that I will find you what you need.
Now, you had experience, but what were you most surprised about after you had your baby that you didn't think was going to be?
How well I functioned with no sleep for the first 2 months.
I can't say that. I was so emotional.
That's fair.
Crying.
That's fair.
But we lived in the country, and it was my first time not working. So, there was so much to adjust to. But I can't imagine. Because you still went to work. Did you have?
I was actually still in school at the time.
Oh, that's right. Okay. Yep. Oh, gosh.
So I was still in school, and I was studying for board exams and doing all of that. So it was a little bit stressful. I wouldn't change it now, but it was a crazy time.
Well, and they always say, sleep when the baby sleeps.
That's when you usually get things done, unfortunately. I tell all my parents to do the same, but I say, I know that that's not all that realistic. Just get a nap here or there when you can. And
they're upside down in their timing. So what I didn't know was that baby's usually awake at night, those first couple weeks, and then sleeping during the day. Even as a photographer, I didn't realize that that's why 9 a.m. is usually the best time for a session.
For sure.
And they don't get right. I can't remember how long it is because I feel like we're still sleep struggle, but it's a couple months or something till they get really regulated.
For sure. And then you get regulated, and then you get
into
those sleep regressions. And so you go through all that.
gosh.
Something that I guess I'll plug is we used a course online called Taking Care of Babies.
Okay.
It was a nurse that I believe was also a lactation consultant that realized that there wasn't enough resources for parents. And so she created a whole class on parenting for infants up through, and specifically sleep training. So we followed that, and we have a really good sleeper now. She sleeps 12 hours a night, takes a 3-hour nap during the day. So we are blessed. But
you're still napping.
Oh, yes.
Oh, we were out a nap at like 2.5 for my oldest, to be fair, she's on the spectrum. And part of what we noticed was that when she got a nap, she had night terrors at night. Okay. So we went through a night terror phase.
For sure.
So we took out the nap, and then actually those went away, which I've heard from doctors that just some kids go through that phase.
For sure.
My youngest, who doesn't stop moving, the naps caused her to go to bed later at night. So we just had to eventually take them out. So she was exhausted enough to go to, every kid is so different.
So different. Yeah.
That would be a great resource to have, because I went down the Google,
For sure. It's nice to have a resource that's got a little bit of education backing.
Okay.
And so just recently I reached out to their team and was able to get a discount for people in my office.
Is this a local?
No,
national?
So it's a national.
Okay.
I don't know where she's actually based out of.
Okay.
And I've never spoke to her personally, but we used it for ourselves, and we really liked it. So I just, again, resources. Okay. Wherever I can have resources, I try to get resources.
Yeah, my doctor didn't give us a whole lot. Well, okay, I will say the first baby, they sent us home with literally a stack of papers, and my mother-in-law said, don't read those, they will scare you. And I mean, a lot of it is warnings, and I won't go into what, but I read some of it, and then I would go and do the Google search, which we all know is not always reliable, because you get everybody's opinions, but so it would be nice to have that resource. But my doctor would tell me often that you're just in survival mode, whatever you gotta do.
That's no lie, but then that gets back into the chiropractic. When you're in survival mode, there's
so much tension.
There's so much tension, and your neurological system basically has two different phases: the fight or flight, or you're getting chased by a bear, which is that survival mode, or the rest and digest. And when our neurological system is clear with less tension, you're more in that rest and digest, so that you can better be there for the family.
And probably be a better parent. I mean, I don't want to say a better parent, but a better...
Be there better.
Yeah.
Best way to say it. I get it.
It's a tough thing, and I think that would be great. I'm hoping to have a lot of moms in who are either prepping or in that care, so that you can educate them. So it's great that we have the other two coming in. And you're going to do a demonstration. Yeah, correct?
So I'll do a demonstration. She won't be pregnant, but I'll go through a whole Webster technique so that people can see what it is, because some people have never had chiropractic care in the past.
Oh, yeah.
And so there's a lot of blurred lines on what you see on social media versus what in reality it is. So I'll be adjusting someone during that, and then we'll also open it up for a Q&A at the end.
Okay.
Just because we're going to throw a lot of stuff at people, but we might miss something, or it might bring up questions, and so we'll be there to answer questions after the fact also.
All right, that's awesome. We're really excited to be able to bring this to people. I know, like we've been talking about, there seems to be maybe not a lack of resources, but maybe a lack of communication.
For sure.
Of what I should be doing, how I can access it. And so it's just one more way to
it's just the education piece.
Yeah, me as a mom to be able to connect
to
people who need the resources. Because I have done it, but like I said, I'm already 5 years out, and things have changed already. In 5
Things change quickly in our
can't even... the seatbelt laws changed when I had my first. So, that was one question I had actually with kids going into the car seats with newborns. Do you find that you have a particular one that you like for stabilization or anything?
Not really. I mean, they all have their quirks, right?
Okay.
And what I usually tell parents is find one that the kid likes.
Okay.
It's going to make your life a lot easier. And when there's less stress on you, there's less stress on baby. And so that's best.
I guess I didn't even think about trying out a different car seat.
Yeah, because, I mean, some car seats are going to feel better. I mean, it's like hopping into a car. Some car seats are more comfortable to other people, just like the regular car seats. So just finding one that's best for the kiddo.
Okay.
I mean, they all are through all the training or the testing and stuff. So hopefully all of them are safe. And it's just about finding which one's best for you.
Okay. That was the other, I think, hard part leaving the hospital was having to have them check the seatbelt in the car seat.
Yeah. Make sure you do it right.
Yeah, that was one of the things that held us up from leaving was we had to wait for somebody to come and check the car to make sure we had, which is a great thing, but it was, some people it's like, I'm ready to go home now, and now we've got to wait.
For sure.
So, all right, I'm going to do some rapid fire things. Okay. What's the biggest myth about chiropractic care during pregnancy?
That it's only about pain.
Okay.
It's only about pain.
So, I mean, it's whole body wellness.
It's whole body wellness. Let's optimize the body so that the body is ready to do what it's naturally made to do.
Okay. All right. Biggest myth about newborn chiropractic care?
Biggest myth is that you probably people say that you shouldn't have your baby adjusted because they don't need it.
Okay.
But that gets back into our trauma of the birth and everything a baby goes through as it's growing.
Okay. Is cracking or popping necessary for an adjustment to work?
No. So the cracking and popping is just a gas release in between the vertebrae in your disc, actually. And so
I didn't know that.
98% of the time, you're going to get a crack or a pop.
Okay.
That's just how it is. But with our technique, I don't need to have that crack or pop to know it worked.
Okay.
It's all about the muscle tone balance, knowing that the neurological system's clear.
Okay. And this isn't part of it, but should you crack your knuckles?
Cracking your knuckles, not bad.
Really? Okay.
Just the gas release.
Okay.
You might come across a chiropractor that says never to crack anything. People crack
I'm
their
very
knuckles.
much like I got to do this because it's just almost, but I think it was the 90s, we would get told by our parents that that's how we would get arthritis. Now my knee is naturally cracked.
Well, there you
because of the arthritis I have. But
the one thing I will say is the knuckles, whatever.
Okay.
It's the people that self-adjust their neck.
I don't even know how to do that. So.
You'll see people that are like, I'm not going to do it, but like doing this type of thing and cracking their neck. So I find that when I have a new client and they lay down and I start feeling their neck, I can tell if they self-adjust their neck. So the muscle in your upper cervical, there's tiny little muscles that attach from the base of your skull to the first, the second, and all the way through. And the best way I can describe it, and I kind of laugh at it, I use the word boggy, and I don't know that makes any sense to people, but what you're doing when you're pulling and pushing things that aren't supposed to stretch in that way, because we're not doing an actual chiropractic adjustment, is you're pulling those muscle fibers past where they should be. And so avoid adjusting your upper cervical.
I don't even know if I've done that. I've seen people do it. I know what you're talking about, but I don't know if I've ever gotten it to work, which I don't want it to work. So this is unrelated to my list, but do you see people when they walk and you're like, oh, they need to be adjusted?
I mean, yes.
I've heard that from one other person. I was like, man, that's got to be annoying.
I've gotten to the point where I'll just walk by and hand them a business card and say, if you want to come see me.
Okay.
And have that conversation.
Okay.
Again,
I've tried that with pregnant women too. Like, hey, I'm a photographer, but that doesn't always work.
It doesn't always work. And luckily what I found is this area is decently educated on the chiropractic care side of things. So a lot of people are under chiropractic care, and I'll like run into someone and I'll start having the conversation about chiropractic care with someone, and they'll be like, well, I go see so-and-so. I'm like, amazing. Please continue to see them, because I'd rather have someone seeing a chiropractor, getting adjusted, reducing the tension on their neurological system, than them not seeing. So go see someone.
Yeah, that makes total sense. Coffee before an adjustment or after, does it matter? The caffeine?
I don't think it matters.
Okay, that's good to know. Yep. What's one thing every expecting mom should know?
That you'll get through it. That you'll get through it. There's going to be good days. There's going to be tough days. And
I actually just posted on this on my socials today, because 5 years old, we're finishing 4K today, and it feels like, I just remember there were nights when it's like, is this ever going to end?
Yep.
And we're told you don't want the phases to stop. Like, don't wish it.
For sure.
But there's just certain phases where you're like, can we please move past this?
There's definitely some nights you're going to feel like,
I'm going to die.
When is this going to end? But you get through it and you look back and it's still the biggest blessing.
So fast, though. It is crazy.
It is. It goes
I do
by
not understand time.
The days are long, but the years are short.
Yes. We were just talking, too, with my mom about how it's already June. And now I feel like I need to start Christmas shopping, because Christmas is going to be here before we know it. All right, last one. What's one thing every postpartum mom deserves to hear?
That's a good question. I mean, there's a lot of things rolling through my head, right?
Okay.
I mean, you did it. I mean, that's God's creation that you helped create. I mean, it's absolutely amazing what the female body does to create a baby. I mean, no male can do it. And so it's an amazing thing that women can do. And it's a major blessing.
That's awesome.
Yeah.
All right. And now you're based out of Hudson, right?
Yes.
Okay. And where is your office?
So I'm right downtown in the Riverfront building. So if you know where like Lucky Guys Distillery, Carboni's, there's that big parking lot there. I'm right there. Okay. The best way to contact me would be going to chiroway.com/Hudson, Wisconsin. And all my contact info is there. Okay. And like I said, if anyone ever has any questions, they can just reach out and I'll sit down and have a conversation.
Is there more than one Chiroway in Hudson?
So it's just me, but we are a franchise. So kind of locally in the area, if Hudson doesn't work for you, we have River Falls, Stillwater, Lake Elmo, Woodbury would be like the
And when are you coming to New Richmond?
Hey, we're not that far from New Richmond. Maybe someday. I'm never going to say I'm not.
The only reason I say that is because, I live in Emerald, so 20 minutes out. Hudson then becomes a further drive than me. We have a lot of rural communities around here.
Yeah. So maybe someday.
Okay.
Someday. My long-term goal is to open multiple and be able to serve more and more communities.
One step at a time.
Yes.
Okay.
Yes.
Well, thank you so much.
Yes,
we're excited for the education night. I'll post that up here, and we hope to see you there.
Awesome. Thank you.
Thank you.
Yes.
Perfect.
Beautiful.
Yeah, it's